Actually, the weather, the season, and especially our college is named Santiniketan Medical College. And also you are aware of Santiniketan's Holi or Dol Utsav. It is Basanta Utsav. Now, I was a student of Vishwabharati for a couple of months in the Department of Botany, 1973. Why I have a place in my heart before in this when I was a kid. I used to attend the Posh Mela and Basant Utsav. It is the memories are coming back. It comes every day. I will be wishing my friends who are in WhatsApp with me. I left Santiniketan, but the feeling for Santiniketan, I think God destined me, my fate, that I came back. I am already back to my roots, that is Shaitya, but I was really glad when Malai Babu called me on the first meeting. It's a core meeting was there when he was planned already, that he'll develop the college. And I got the opportunity. I am blessed. These 2 days, on Wednesday we are having Holi and Tuesday is Basanto Utsav. Okay. Now, how you will spend your days, it is up to you. I'll be in the campus on Wednesday and Thursday also. I don't like to mark anyone. And with this, I'm just giving you I thought that I would share because some of you looked at each other, that I was a student in Santiniketan. Now, okay. Now, today, I have to deliver on esophagus. Now, esophagus, these two competency-based undergraduate curriculum describe and demonstrate external appearance, relations, blood supply, nerve supply, lymphatic drainage, and applied anatomy of the esophagus. Describe the extent, length, relations, blood supply, lymphatic drainage, and nerve supply of trachea. Already, when you are doing thorax, you are knowing the relation with the trachea, with the esophagus. That will be a bit of your repetition. Now, write short notes on esophagus, origin, parts, relation, and clinical anatomy. Enumerate sites of normal constrictions of esophagus and their levels. Now, it will come in the theory paper, short note or how to describe the esophagus in the thorax, the thoracic part of the esophagus. And you have to know the constrictions, at what level the constriction is there. Everything you have to know. Now, mucomuscular tube connecting pharynx with the stomach has 3 parts: cervical part, thoracic part, and abdominal part. Thank you, making the place dark. Now, it has 3 parts. See, pharynx, just posterior to the tongue. Pharynx, then you have the neck, then the thoracic part. You don't have to Don't. You just draw cervical like this, label it. Your tabs and your books are sufficient enough. Now, the length 25 centimeters or 10 inches, see MCQ. Width is 2 centimeters. Lumen normally closed and opens only during passage of food. Now, normally closed, it's like this. But when you take, say, you are sipping water, then its action starts. Okay. Now, if at all a boy swallowed a coin, 1 rupee coin, you just see and examine with just to ask him to sip water. If anything got stuck, then he'll just repel. If it is stuck horizontally, then things will accumulate, the food he has taken or water is taken, it will level. But the nature is such that it will compress and try to this thing. If a small child swallows a coin or any foreign body, you have to go for a straight X-ray. Not MRI, not CT, just do a plain X-ray, radiology. And you will be getting epilateral views, and then you see if it is located. If it is not there, it will go to the stomach, then it will be again, if it obstructs the pyloric end of the stomach, then it will contract and it will cause pain and it will swell up, or it will just, you will be seeing the peristalsis. Any pyloric obstruction will produce now if any foreign body or some like you take a kebab or something, you just and with friends, that kami khai. Suddenly it goes pressurized, but it might get stuck in the pyloric end. So never like you have any nuts or something like that, or peanuts in the train you buy, you just go and putting it. Nowadays you're getting green peas, sweet. You just peel and then take. You don't throw any food like that, because it will affect and it might cause obstruction. So from pharynx, now esophagus begins as a continuation of the pharynx at lower border of the cricoid cartilage, passes downwards in front of the vertebra through superior and posterior mediastinum of the thorax, pierces diaphragm opposite T10 vertebra and finally opens in the cardiac end of the stomach at T11. Pierces the diaphragm at T10 level vertebra and finally opens at cardiac end of the stomach at T11 vertebra. Now the diaphragm separates the abdominal cavity from the thoracic cavity. Now why I'm telling you, I'm stressing you because it can be a small MCQ. And diaphragm is a major part that is separate. वो तो मुझे पता है, नहीं पता जो है, लेकिन आपको एग्जामिनेशन के लिए लड़ना है. Your focus will be on the examination. Please, I'm repeating. I have been telling this every day from the day you joined college. Now you are getting bored. Now you see, This type of drawings I'm saying. The pharynx, and you see first Faringo-esophageal junction, 4 centimeters, cervical part. The thoracic part, esophagus. And the abdominal part, 1 to 2 centimeters here. Now, fourth, at the passage through diaphragm here. And this is the stomach. Now, you see, this is important. Now, this part, the third crossing of the left principal bronchus, second is crossing at the arch of the aorta, first junction of the pharynx, the constriction, Faringo-esophageal junction. This is the constriction in the first Faringo-esophageal junction, second crossing at the arch of the aorta, third crossing in the left principal bronchus, fourth at the passage through the diaphragm. This is important for a 4-mark short question. This is important because constrictions of the esophagus in the thoracic cavity. This from the pharynx to the diaphragm. Now, now esophagus has following curvatures, anterior-posterior curvatures. First corresponds to the curvature of the cervical vertebra, and whereas second corresponds to the curvature of the thoracic vertebra. I told you that Booth, the skeleton, in your demonstration room or dissection room, you please follow this. I told you this, I showed you yesterday on the vertebral PowerPoint slides. So you saw, I showed you the curvature. At that levels are the places where the esophagus have constrictions. Now esophagus lists constrictions of the esophagus and their levels. See, again it's a repetition. Second narrowest part of the digestive tube, vermiform appendix is the narrowest. Usually esophagus shows 4 constrictions as follows. Now list constriction of the esophagus and their levels. Now the second narrowest part of the digestive tube, the whole digestive tube, you see, but usually the vermiform appendix is the narrowest. Now usually esophagus shows constrictions as follows. First constriction at Faringo-esophageal junction at 6 inches from the incisor teeth. It's a common question in the Viva table. When you ask to hold the stomach, then you go and describe that this is the esophageal end, or the cardiac end, this is the pyloric end. You hold it like this, like this. Okay. Now you will be fine. Then the Faringo-esophageal junction, that's 15 centimeters, so 6 inches from incisor teeth. Whatever you feel comfortable. 15 centimeters or your 6 inches. You have to just remember, and from incisor tooth. Okay. Now, produced by cricopharyngeus part of the inferior constrictor muscles of the pharynx. Cricopharyngeus part of the inferior constrictor muscles of the pharynx. Now, second constrictions. Second constriction at crossing of arch of the aorta, 9 inches from the incisor teeth. So, incisor teeth is taken as a landmark, or it is the flagship. Okay, from that, to make you understand, also memorize second incisor tooth. Then these constrictions are there. Now, third constrictions at crossing of left principal bronchus, here, and principal bronchus 11 inches from the incisor tooth. 11 inches from the incisor teeth. Fourth constriction, see, 6 inches, this is 9 inches, this is 11 inches, This is 15 inches. So by inches, if you answer, you will get the marks, and it is easy to remember. Okay. Now, fourth constrictions at passage through the diaphragm, 15 inches from the incisor teeth. This is important. Everything is important. Here, relationship of the esophagus has cervical 4 centimeters, thoracic 20 centimeters, and abdominal 1 to 2 centimeters. Parts relation of thoracic part of the esophagus. Trachea, arch of the aorta, right pulmonary artery, left principal bronchus, pericardium with left atrium, diaphragm. 1, 2, 3, 4, 5. Okay. You just the skeleton, and now it will be easier when you go to the body and the structures in the neck, and it is easy to remember in this format that you are now it just say if you put it in this TARLPD, okay. Now esophagus, right lung and the pleura, azygos vein and right vagus nerve. This is the vertebra and this is the esophagus. Now this is green, thoracic duct cross to the left at T5 level. Azygos vein, this is the hemiazygos vein. This is the sympathetic trunk, right sympathetic trunk and left sympathetic trunk. That sympathetic trunk chain is more or less similar, but there are some, may be a condition. So you please use some highlighter pen. Recently I went to the stationery shop. Hauser company has brought very beautiful this highlighter pens. Don't take the Mota Babu Nebena. You take Shahrukh Khan, Slim. Okay. I'm just comparing, I bought one packet. Of course, whatever you have, that you use, that's I would say. But if you want to draw like this, then you put in a highlighter. Then you go, these colors go and get embossed, I would say embossed, in your brain. Okay. Now, the right lung and pleura, azygos vein, right vagus nerve. Okay. Now, superior mediastinum, to left, arch of the aorta, left subclavian artery, left recurrent laryngeal nerve, thoracic duct, left lung and pleura, posterior mediastinum, descending aorta and left lung and pleura. This is the picture. You can make, you buy card, white card. Okay. And you can draw on, or best is your khata. Not small notebook or something like that. You have borrow. Yesterday in the news, Trump is writing. The American people, I think they practice calligraphy or who's ever interested. But most of the American schools or anything is one format. Like if you are from any school, especially English medium school, the writing is the same for, if there is 50 students, it will be more or less same. Like when we were a kid, I was in the hostel in St. Pat's School, Asansol. We used to write postcard, letter on Saturdays. And in the evening, Saturdays, you write, that would be written in the board. My dear, my loving mom and dad, I am well, even if I am not well or not having good food. That is written, we copy and paste, and the same similar writings we are having. Of course, there were some different students have different this thing, but this is the thing that you have this type of illustrations. Okay. Now, histology has the following layers. Mucosa consists of stratified squamous epithelium, non-keratinized, lamina propria and muscularis mucosae, thick, longitudinal and smooth muscles. Thick, longitudinal and smooth muscles. Okay, you have seen in the histology, I told you it's a common, now, mucosa consists of stratified squamous epithelium, non-keratinized, lamina propria and muscularis mucosae, thick, longitudinal and smooth muscles. Submucosa consists of dense, irregular connective tissue with elastic fibers and compound tubulo-alveolar glands. Tubulo-alveolar glands. Now, see, elastic fibers, dense, irregular connective tissue with elastic fibers and compound tubulo-alveolar glands. There is some mucus that has to be secreted. Now, you take a food. Now, if any food, dry food you take, you take water, isn't it? When you are taking some dry food, okay, it is not this. Sometimes see, muri is a bhelpuri that is in Bombay. Everywhere you will get, throughout India you will get muri. And Bengalis, if there was no muri, I think the women folk would have been thinking what to give for dinner. Because muri is such a content that you can eat with mangsho jhol. Okay, you can take with sabji. You can take with any gugni. Gugni means any this thing, chole or anything. Now, plus just simple dal. Okay, that's easy to swallow. You see, when you're in a hurry and your mom comes with the thing, Ma, to jal diye dao, or give, you don't ask for milk actually. Okay, that's it. It can pass through the esophagus smoothly. Now, muscularis externa. Upper third of the esophagus has skeletal muscle fibers. In middle third, both skeletal and smooth muscle fibers, whereas in lower third, only smooth fibers. This is important, have to know that as you go down, the upper third of the esophagus has skeletal muscle fibers. In the middle third, both skeletal and smooth muscles, whereas in lower third, only smooth muscle fibers. The action, the way it propels the food, so it needs some strength. So skeletal muscles, your smooth skeletal muscles, smooth muscle fibers, and lower smooth muscle fibers. Adventitia surrounded by connective tissue, only lowest 1 inch surrounded by serosa, peritoneum. Okay? Now, clinical integration, esophageal varices are dilated, tortuous submucosal veins in the lower part of the esophagus called portal hypertension. Pathology, increased portal venous pressure causing shunting of blood from the portal vein tributaries to the systemic veins, vena cava. Lower part of esophagus, portal vein, left gastric vein, esophageal vein, site of anastomosis, azygos vein, superior vena cava, symptoms bleeding and vomiting and hematemesis. This is very important clinically. If there are 100 patients admitted in your medicine ward, medical ward, with cirrhotic liver and different disease condition, at least you will find 5 with this varicosity and esophageal varices, or patient coming into the acute with hematemesis, that is bleeding per mouth. Now, even when you are having hemoptysis, that is bleeding from the lung. It's bleeding from the lung, that is hemoptysis, and hematemesis. See, in hemoptysis, if the person is coughing, it will go, sir, এত blood এসছে, এই এতটা করে, বাটি blood আসছে। কিন্তু যখন কাশছে তখনই আসছে। Then when the patient is you're complaining that pure blood, red, you think there's some lung disorder. In hematemesis, he vomits, that he swallows the blood, or the blood trickles down into the stomach, then it is coffee ground. Without milk, coffee ground. You see, you take a coffee and see. And anyone can panic. Anyone can, even a patient in emergency in my nursing home. He was vomiting blood, coffee ground from morning. He came, reported to us around 1 noon, 12 or 1. And he vomited so much that he collapsed. He died in front of my eyes. I could not do anything except put a drip. So any patient with reflux esophagitis, any patient with varices, any patient comes to, don't underestimate, don't take it for granted. The patient, when you are writing a prescription, R, H, Rantac to ami খেয়েছি, I have taken Rantac. अरे भाई, तुम Rantac लिखोगे ना कुछ लिखोगे, उसको नहीं पता. लेकिन he is saying repeatedly, আমি একটা গ্যাস অম্বলের ওষুধ খাই. I take medicine for acidity and gas. Okay, then you just say, hey, আমি কি লিখবো না লিখবো তুমি, don't talk like that. You say, sir, বাবু, আমি একটু লিখছি, একটা কিছু করতে হবে তোমার. Then what you write? First, investigations. Now, every place, say in our Bolpur, at least 4 places are having gastroduodenoscopy. In Shuri, anywhere you will be within 25-30 kilometers or 50 kilometers or 100 kilometers, you need not bother. But you will find to do gastroduodenoscopy. But and see if there is varices, see if there is any ulcers or any in acute emergencies. Now I told you this coffee ground color, that is this is related to your stomach and esophagus, and hemoptysis, HAEMOPTYSIS. That's frank. I'm not continuing that word. Frank blood. that you can clinically also you try to evaluate and see exactly. There is one village after Rampurat in Jharkhand, Birbhum and Jharkhand border, Bengal and Jharkhand border. It is in Jharkhand. Birkiti. The village name is Birkiti. Any patient comes, Dr. Babu, I ask them, না আমার কাশির সঙ্গে রক্ত আসছে, I am coughing out blood. আমরা বাড়ি কোথায়? এই রামপুরহাটের দিকে। আমরা বিরকিটি? বললো হ্যাঁ। Now, why I want to say is that you can actually, if I had the position, my position, then I would have made a study in that village around. If I was in the government, this thing, and encountered so many patients, then I would persuade the government to make a study of that area. And most of them are suffering from pulmonary tuberculosis. Now, why, you see which region, what industrial area, or any, your stone chips, the Pathar Khadan. Now, the talk of the month or more will last Aravalli Hills. It is being sold to some persons. Again, after that stay order and all, they have stopped it. Now, these things are at rampant. That dust, cement dust also can cause respiratory problems. Now, this is one thing. Now, clinical intrication, esophageal varices, short note. You have to make the difference between your hematemesis and hemoptysis. Okay? Now, this is the histology of the esophagus. You have to know that I told you to the initial stage when you were asked to draw the epithelial tissue or your microscope, I told you that you have to know the place. Now, esophagus is having a mucosa, submucosa, muscularis, externa, adventitia. Now, see, I told you that histology contains 15 marks. So, whatever exams you did in this your semester, there was no histology. Now, in your second semester, so you start preparing as your stomach, all the visceras that is in the abdomen, the thoracic part, the lung tissue, the cardiac muscles and all, histology. And your head neck, you'll be having some slides. Now, you integrate and correlate the organs which are in their specific place in the abdomen or thorax or in the pelvic cavity. Please, when you are reading a chapter, you try to integrate and must the histological part also. You have to score marks. Now, naturally, if it is 10, I'm saying 10 to 15, or 10, I'm saying, the 10 marks, at least you have to target 9 mujhe milna hai. That means 9, a jump. So, histology. Now still, I told you the initial stage that you please khata, where you have to purchase the khata. I told you that. But still you are getting signed microscope. Again, what will happen? By the time you sit for exam, people are coming with their your night suit or some dress, running to get it signed. Exam का पहले दिन भी sign करो. अरे, you have to now focus. See these. I told you that you finish drawing and put in. As the chapters come, put in. Okay. Now histology of esophagus I have not repeated. Now venous drainage of the esophagus. See the network like this. See the blue. And see, this is the inferior vena cava. This is the short gastric veins. The splenic vein, the portal vein. This is the portal vein. Superior mesenteric vein. Now you see the internal jugular vein. Now inferior thyroid vein and right brachiocephalic vein, superior vena cava, azygos vein. See azygos vein. And accessory hemiazygos vein, esophageal plexus, hemiazygos vein. Now venous drainage, this is important because azygos, hemiazygos, accessory hemiazygos, these terminologies. So it is to be remembered. It is to be, it can be a short question of 4 marks. Okay. Now blood supply, lineage and nerve supply. Arterial supply, cervical part of esophagus supplied by inferior thyroid artery, thoracic part of esophagus supplied by esophageal branches of aorta, abdominal part of esophagus supplied by left gastric and left phrenic arteries. Now cervical part supplied by inferior thyroid. The cervical. Location onujai, the nearest is the inferior thyroid. So it supplies the upper portion. Now thoracic part, esophagus supplied by the esophageal branches of the aorta. Abdominal part, esophageal supplied by left gastric and left phrenic arteries. Nerve supply, sympathetic fibers from T5, T9 spinal segment are vasomotor and sensory. Parasympathetic fibers from recurrent laryngeal nerve and vagus nerves are motor and secretomotor glands. The sympathetic, parasympathetic. See, in case these visceras, in case you don't remember at that point of time the specific root value, at least sympathetic, parasympathetic to below. Even when you are asked, you are answering very well. Or you are asked that what is the nerve supply of the liver? What is the nerve supply of the esophagus? What is the nerve supply of the stomach? Hey, Avinash, ये हमारे viscera, esophagus, stomach একসাথে আছে? Okay. Anyway, you will get esophagus, you will get stomach. Okay. Composite name, you handling some that long, actually that becomes difficult. Anyway, now clinically referred pain of esophagus. Referred pain of esophagus, heartburn, esophageal pain carried by sympathetic fibers, T4, T5 segments. Esophagitis, inflammation of esophagus occurs in gastroesophageal reflex, GERD. Pain of esophagitis felt in the region of the chest wall supplied by T4 and T5 spinal nerves, lower thoracic in epigastric region. May be difficult to distinguish esophageal pain from an anginal pain. Well, this is a very common thing. Even a patient comes, you, Dr. Babu, আমার খুব একটা চাপা অম্বল হচ্ছে. Ombol means acidity. Okay. Now, then he says, এখানে চাপ ধরে আছে. I mean, you ask if this is a repetition or not. বললো এক এক সময় হয়, ওটা চাপা অম্বল গ্যাস, আমি একটু সোডা খেয়ে নিই, একটা থামস আপ খেয়ে নিই, একটা স্প্রাইট খেয়ে নিই। But he came to you. You first call for a ECG technician, or the clinic you are sitting in, they are having all machines, automated machines. So they'll do a ECG করে দাও তো, বেশ ঠিক আছে আপনার হার্টের অবস্থাটা দেখে নিচ্ছে, না আমার হার্টের কিছু হয়নি। তাহলে তুমি এলে কেন? Why you have come to me? Don't lose your head. বাবু তুমি এলে কেন আমার কাছে? You have to be firm when you are speaking. To put it in your head in just 1 second or 1 minute that you have to do it. Then that comes as an anginal pain. Then if there is a blood hematological services, you test for your some biochemical tests. Best is that when you sense this type of problem, transport him to any higher center. But I'm just telling you what I am experiencing for the last 50 years from my clinical observation and practice and all this thing. If you say, you pain, আমার ডান দিকটা ব্যথা হচ্ছে, you press, then you say, McBurney's sign is positive. You do other tests also, but you tell him, see, the person you are telling that you have to go for an ECG and cardiac checkup to the nearest higher clinic or something like that. He says, "Nahi, kamar kichu na hai heart." The next day you will hear that he died. But if you tell the appendix, Babu, ki korbo? What will I do? দেখুন ভালো করে দেখুন বাবু, না আমি সন্ধ্যে 6টায় অপারেশন করব। People go rushing up to you. না ডাক্তারবাবু রাগ করবেন না, ডাক্তারবাবু বলে দিন। I would rather say, and I favor for interval appendicectomy. It is not an acute emergency. It won't bomb blast like Hiroshima's atomic bomb. Appendix burst kore gelo. This is the most 4th generation, 5th generation antibiotic, cephalosporin, and different types of double antibiotic. You are having weapon. Like Modi ji went to Israel, he's dealing with some high-speed lasers and all these aircrafts for the army. So it is not that. So interval appendicectomy, the term I use, so naturally I'm telling you that you can postpone for 24 hours or 40 hours, 8 hours with antibiotic, IV fluids and everything. But those friends of mine who are saying, no, this is an acute emergency, korte hobe. Korte hoy na. So this is the now esophagitis. The inflammation of the esophagus occurs in the gastroesophageal reflex disease. Pain of esophagitis is felt in the region of the chest wall, supplied by T4 and T5 spinal nerves, lower thoracic epigastric region. Now, ECG, even if they have a good center, then you go for an echocardiography. If you are in a dilemma, but if you learn the basic ECG, the normal ECG, so that's a graph like this. If there's some, again, you open up that strip and see if there is any abnormality. Even the machines, a good machine, that is computerized, and that gives you abnormal ECG or normal ECG. Then you take an opinion of a cardiologist in your clinic. If you don't want to take any risk, send him or her in the hospital. Now, clinical esophagoscopy, visualization of interior of the esophagus using esophagoscope. Dysphagia, difficulty in swallowing, may occur during esophageal compression of external structures or narrow strictures of the esophageal lumen. Okay. Now, achalasia cardia, failure of relaxation of the esophageal sphincter due to congenital absence of ganglia. Now, this is now you are having very good your duodenoscope, gastrointestinal, you do endoscopy. Then but if the scope does not negotiate, does not go through, that means there is some growth. Actually, there is one thing is lacking in the concept, I would say, that when a person doing a gastroduodenoscopy, when he finds any lesion like this, he again gives the report, biopsy should be taken. And one very common your root test. Now, this is a small cassette with this thing, and if there is from yellow color to pink color, it turns, that is root positive. That means person is having H. pylori infection, Helicobacter pylori. Previously, it was thought that all peptic ulcers, duodenal ulcers are caused by vagus, more acid secretion. That time, at least in our college days, the general surgeon used to do many things. And I saw 2 or 3 operations, the vagotomy. Vagus nerve ko cut dete. But yet that results with the 20 years, 10 years, this study, everyone, not in our India, that this type of studies are not performed. But nowadays, there is an inclination of multi-center studies. Few people, gastroenterologists, are getting together. That's a good sign that it is a interdisciplinary research that to what is the outcome. Now, they have found that H. pylori is the main culprit. Now you see, and this nowadays, what's the barium swallow? It's a barium sulfate, is a opaque powder. You put in a glass of water and just go mix it. Then ask the patient to drink. And as he is drinking, he is taking the radiographer, and the radiologist is taking the X-rays, radiographs, 5 minutes, 10 minutes, 15 minutes, 20 minutes, like this. Like you do IVU, USG, whatever you are getting, but in IVU, you will be getting the images, give an injection, intravenous urography. Now, you get the whole, there are plates, it will be given to you during exams, it will be shown to you during our classes. So, I have collected, those plates are there. I think we don't have a barium swallow, because directly your GI endoscopy is being done. At times, I think there is a barium series, you just will see, and in our collection, and you see at times The appendix. The appendix is the, I'm just saying the ascending colon. This is the appendix, coniform appendix. So the barium comes and goes into this. Then you get the image of the barium, appendix entering the barium. Sometimes there are ficcoliths, stone-like stones that is formed by the fecal matter. You get a ficcolith here. Then what happens? The picture doesn't come. The barium cannot come. So the barium goes through this. The barium goes, and you can take series of very good radiological plates, and now tracheo-esophageal fistula. This is the very most common congenital anomaly of esophagus. Abnormal congenital communication between trachea and esophagus, failure of development of laryngotracheal septum. This is the defect. Tracheo-esophageal fistula can be a short note. It can be an MCQ. Okay, because this basic embryology, Dr. Abhijit sir will be teaching you. Now, what I want to say is that you see, after you are done, any of you can become a gynecologist and obstetrician. Now, after you scissor or normal delivery, you take out the baby and you hand it over, and you walk off. For the next mission, Rampurat. Now, at least, no, the pediatrician dekhega. I tell you, in these days even, if I'm having a lower uterine emergency cesarean section at 10 a.m., the pediatrician comes at 7 p.m. Now what you do? Gloves could be you are assisting, you are an intern, or you are doing your SR ship or a house staff ship. It is your duty to see it. Your Arup sir won't see. Because he has seen some thousands, lakhs. But for your sake, your own sake, you turn the baby, see if the baby is having a talipes or having any anal septum, potty kiya ki nahi kiya, urinating or not. If the male child, your the phimosis is there or not. Just quick, turn, you see if the spine, see if there is any congenital anomaly, spina bifida or something like that. Just quick, it takes 5 minutes. But due to the modern investigation and anomaly scan at 18 to 22 weeks, most of the things are detected. If there is any cardiac defect, even fetal surgery is being done before birth, even some post-birth, it's not addressed to. It's not like the sonologist says that anomaly scan is no. 70%, 80%, the 30% or 40% is not diagnosed by the ultrasonography. But there, if he points out 2 places mostly, that is the brain, if the ventricles are some abnormality or there is any hydrocephalus or something like that, any spine, and the heart. If there is any defect, then you have to do fetal echocardiography. There are few centers, Huh? Over here nearest is your mission hospital, because they are doing many pediatrics cardiological problems they are addressing. Okay? Now, now carcinoma of the lower third of the esophagus occurs mostly in the lower part of the esophagus, produces difficulty in swallowing. Barrett's esophagus. Now, this is a short note or MCQ. Now, lining epithelium of esophagus changes from stratified squamous to simple columnar epithelium with goblet cells. Main cause of Barrett's esophagus is GRD. Precancerous condition. It's a precancerous condition. So, ombol gas. Don't depend on gas. It will be like you will be on the balloon, gas balloon. I want to be on a gas balloon. Okay. Now, many tourist spots are, now this morphology of the esophagus. Now, many things I've told you that was not related to the esophagus, but it was related. Don't take it for bunk. এটা বাজে কথা বলছে, শুধু ইসোফেগাসটা বললে ভালো হয়, আমি কিন্তু সেই জায়গায় নেই। I'm telling you the practical aspects of both part. Because esophagus বাদ দিয়ে তো স্টমাকের কথা ভাববে না। তুমি cardiac enter ভাববে, রিফ্লাক্সে কোথা থেকে আসছে? Where it's coming from? GRD. Gastroesophageal reflux disease. You have to even give advice to the patient how he should lie, what pillow he has to use, and on the right side, like this. Okay? Now, those having practicals, please come over. I'm there. Hey, Abhinav.